I'm Dr. Stephanie Burkhardt, and I completed my postdoc residency here at HealthSource. I've been working with the medical residents for about the last year.
I'm Dr. Leah Moorfield. I'm a third-year family medicine resident, and I've been working with Dr. Burkhardt for the past year.
I am Dr. Sierra Incorbati, and I'm a current postdoctoral fellow, and I've been working with the medical residents for about 2 months here.
So I wanted to share a little bit of a training opportunity we have, a part of our postdoc residency program. So something we do once a month is we come out to Hillsborough, which is our home clinic for our medical residents, and we offer a variety of support. In the morning, we do some live shadowing as they see patients. We also go ahead and lead didactics in the afternoon, focusing on behavioral health topics. And we end the day with Balance Opportunity, or Balance Group, where we host kind of a conversation about meaningful interactions between provider and patients. So it'd be helpful to share a little bit about your experience in this model that we have.
Yeah, so one Wednesday a month, a half day in the morning, one of the behavioral health providers will follow us with some of our patients and monitor the interaction, just watching us throughout the exam, and then afterwards we'll evaluate our interactions with the patients, kind of give us some tips on how to interact with them, what we could have done better, what we did well.
Mm-hmm. Yeah. And then kind of following Dr. Moorfield, one thing I've enjoyed as a fellow is really being able to be in the room with you all and see how the interaction's going, really highlighting what you all do well, because you all are fantastic residents, and then also just areas of improvement. But in addition to observing, one thing I really liked, and Dr. Moorfield, you can say if you like this or not, is doing the didactics. Teaching is something that I personally really love, and with having one day a month where we can provide some information on, today we did bipolar disorders, but before we've done trauma-informed care, I know we have an activity or a didactic that we want to do for feedback. To have that time to teach has been something I really enjoyed, and I don't know if Dr. Moorfield, you found them helpful.
Yeah. Absolutely it has been helpful, especially to get more education in terms of mental health, diagnoses, treatment, because it is something that we see quite frequently in family practice. But not something that we have a lot of education on, a sufficient amount of education in medical school. So definitely to keep being educated on that and learn how to better manage and diagnose these things has been very helpful.
Yeah. And then one thing too that I think is unique that we get the opportunity to do as fellows is to lead the Balance group. I don't think you all ever have a time where you can just process interactions. I feel like a lot of time in residency, you're like, here's the problem, here's what I'm doing, and then you go. But what I've enjoyed is just really having time to dissect these interactions and have different people's perspectives. Dr. Moorfield, I don't know if you have any other experience of Balance group?
Yeah, that one has been super interesting. We never have a shortage of patient examples and encounters that we can bring up. But it is definitely interesting to get the other perspectives of the other providers. It's helpful when people agree with you and you feel seen in what you think of the situation, but it's also helpful when people bring a different perspective that kind of opens your mind to how other people think and process things.
I would say that's also one of the main highlights of getting to do this blended model, right? We each have been trained up in our specialties of different models, but we're partnering together because we're primary care. And we're all here to come together to give best patient care. So I love that it happens a lot in Balance Group, but also just happens throughout the entire partnership of getting to learn from you, as well as being able to impart maybe some of the behavioral health components that may be areas that you didn't have as much focus on in your training.
Yeah, absolutely.